A 52-year-old postmenopausal woman comes to the office due to leakage of a few urine drops with coughing and sneezing. She has no dysuria, urgency, or changes in urinary frequency. The patient has had 3 spontaneous vaginal deliveries. Physical examination is notable for a mild cystocele. The patient is advised to perform exercises to strengthen her pelvic floor as part of treatment for her symptoms. The question is, which of the following structures is the most likely target of the exercise? Your options are choice A, bulbospongiosus muscle, choice B, detrusor muscle, choice C, external urethral sphincter, choice D, internal urethral sphincter, choice E, Levator ani muscle, choice F, uterosacral ligament. Type your answer in the comment box. Congratulations if your answer is E, which is Levator ani muscle. Women who are obese or have had prolonged second stage of labor, multiple vaginal deliveries, or previous pelvic surgery are at increased risk for pelvic floor injury. The pelvic floor is composed of the Levator ani muscles and forms a U-shaped sling around the pelvic viscera. The Levator ani muscles, such as iliococcygeus, pubococcygeus puborectalis, hold the bladder and the urethra in the appropriate anatomic position. Injury to these muscles results in urethral hypermobility and/or pelvic organ prolapse, such as cystocele. Urethral hypermobility results in incomplete closure of the urethra and bladder neck against the anterior vaginal wall, which leads to stress urinary incontinence. Patients with stress urinary incontinence have involuntary urine loss with increased intra-abdominal pressure, example, during coughing, laughing, straining from constipation, and no bladder contraction. First-line management is through lifestyle modifications, such as increased dietary fiber to prevent straining. Urethral support can be strengthened through pelvic floor exercises such as Kegel exercises that involving squeezing and releasing the Levator ani muscles a few times each day. If you chose any option other than E, you were wrong. Let's briefly discuss the other options. Choice A. The bulbospongiosus muscle is part of the superficial urogenital triangle of the perineum. It compresses the vestibular bulb and constricts the vaginal orifice. Choice B. The detrusor muscle is a smooth muscle lining the bladder wall that contracts to release urine from the bladder. Detrusor overactivity results in urge incontinence. Impairment of detrusor contractions from a sacral lesion or autonomic neuropathies will result in overflow incontinence. Choice C. The external urethral sphincter is a skeletal muscle located at the distal end of the urethra and innervated by the pudendal nerve. Voluntary constriction of the external urethral sphincter maintains continence, and prolonged labor can damage this muscle, resulting in urinary incontinence. Choice D. The internal urethral sphincter is a smooth muscle at the proximal junction of the bladder and the urethra. The sympathetic nervous system controls this sphincter to constrict and prevent urine leakage. Choice F. The uterosacral ligaments run along the lateral pelvic wall and anchor the uterus and vaginal apex by attaching to the sacrum. Weakening of these ligaments contributes to uterine and vaginal apical prolapse. If you're finding this difficult to understand, consider watching this episode again.